Hi, my name is Lillian Tran, and I'm going to tell you what I learned throughout my Discourse community project. I had to do it for my intermediate composition class. My Discourse community project focused on the communication disorders community, or also known as those who are speech-language pathologists. Speech-language pathologists, who are often called speech therapists, assess, diagnose, treat, and help to prevent any complications that affect communication, and also those who have swallowing disorders because they can alter speech. During this project, I was able to interview two different speech pathologists in the communication disorders community, one of them being my older sister, Vivian. Vivian has her bachelor's and master's in communication disorders from Loma Linda University. The other speech therapist I interviewed was Roshina. She attained her bachelor's in psychology from Utah University and a master's in communication disorders from Chapman University. I was lucky enough to be able to sit through some of their therapy sessions with their preschoolers. In the interviews and in those sessions, I was able to learn that speech pathologists have to conjure up lengthy, and I mean lengthy, speech and language evaluation reports. In these reports, the speech pathologist will go in great detail of a certain patient while they are able to observe them for any speech problems. Clinical reports, also known as speech and language evaluation reports, are the most used way to communicate within the communication disorders community. Speech pathologists also undergo many meetings, whether it's district meetings, meetings with superiors, meetings with parents or family members of the patient, and many meetings with other speech-language pathologists. SLPs also have to vary their vocabulary when speaking to different members of society. For example, they would be able to say like common terms like resonance to other speech pathologists, but not likely to a young child because they would not understand. Their vocabulary range depending on the listener. I learned that in order to work in schools as a speech pathologist, you have to get a teaching credential as well as get fingerprinted and go through CPR classes. They also get to decorate their classroom however they want and create their own lesson plans. I find it amazing that you get to create your own schedule, so you can choose if you want to do this criteria with the patient today or a different day if it works best for them. When sitting in the therapy sessions with the preschoolers, I learned that the speech pathologist would sneak in learning while playing fun games. For instances, they would go, "Jacob, what sticker do you want?" And then the child would choose a certain sticker. However, if he did not say in a complete sentence, the therapist would go, "Jacob, can you say, 'I want the purple dinosaur sticker, please?'" making him repeat it in order to get the sticker. These speech pathologists also get to play many different games based off their choosing. Therefore, it just seems like you get to, therefore, if you work with kids, it just seems like you're playing instead of working. Obviously, these speech pathologists would do different agendas if they were hospital-based and with older adults, like you wouldn't play games with them. I've just only been able to be in the sessions that were school-based, so I don't know how hospital-based is that much. In the future, if I was able to observe more therapy sessions, I would like to know how some speech pathologists get through sessions with patients that have gone through so much and have a background that would break your heart. I would also like to know how they deal with kids that are crying. I would like to know if they prefer hospital-based or school-based for speech therapy, and I would like to know the difference like in therapy sessions from hospital and school-based. And I think that's it. Thank you for watching.